Building the Framework for Intellectual and Developmental Disabilities, or IDD, Quality Measures. Medicaid managed care is a rapidly growing service delivery model in the United States. Managed care is a healthcare delivery system where companies called managed care organizations, or MCOs, get money from Medicaid to help deliver Medicaid services. While different states use different systems for managed care, states that use managed care hope that it will reduce costs while also increasing the quality of services. While managed care has been around for almost 20 years, it hasn't really been used to provide long-term services and supports, or LTSS, for people with intellectual and developmental disabilities, or IDD. This means there are not a lot of quality standards for managed LTSS for people with IDD. There's also not a lot of research about if it helps people with IDD or results in saving money. Despite the lack of evidence, managed care is expanding into the IDD LTSS system. For this reason, we believe that it's really important to have quality standards and guidelines. In October 2018, CQL, the Council on Quality and Leadership, the Institute on Public Policy for People with Disabilities, and Mosaic organized a workgroup with leaders in the healthcare and LTSS industries about managed LTSS for people with IDD. Workgroup members represent people with disabilities, service providers, managed care organizations, policy experts, researchers, family members, and other key leaders. The workgroup is designed to develop a common understanding of value-based quality measures for people with IDD to ensure that as the industry moves to managed care, the quality metrics utilized are meaningful for people with IDD. The report we're summarizing in this video is a result of the first workgroup meeting. We're trying to create a roadmap to ensure high-quality services and supports for people with IDD. Now let's talk about some of the content of the report. Social determinants of health are conditions, environments, and settings that impact people's health. For example, where people live, if they have friends, if they have a job, and many more factors can actually impact people's health. Because all these factors can impact people's health, it is really important to pay attention to them to ensure that people are healthy and have a high quality of life. We recently developed a new way of measuring social determinants of health using the Personal Outcome Measures, which is a person-centered quality of life tool. We call it the Social Determinants of Health Index. Using the Social Determinants of Health Index, we did an analysis of personal outcome measures interviews with over 1,000 people with disabilities. Our research found that the more organizational supports people receive, the more social determinants they have present, meaning organizational supports significantly improve the health and quality of life of people with disabilities. We also did another analysis looking at how quality services and supports can improve people's health outcomes. For this research, we analyzed data from 28 organizations who supported approximately 3,000 people with IDD using the Basic Assurances. The Basic Assurances is an organizational assessment that looks at the health, safety, and human security of provider organizations. Here are just a few examples of the findings. When organizations respected people's concerns and responded accordingly, the people with IDD they supported visited the emergency department significantly less often. When people were free from unnecessary intrusive interventions, organizations had significantly fewer medication errors. When organizations facilitated each person's desire for natural supports, people with IDD supported had significantly fewer injuries. When organizations ensured people had meaningful days, people with IDD supported had significantly fewer behavioral issues. Findings from this research showed that while traditional measures of health are important, many other factors play a role in quality services and supports and quality of life. As shown in the findings, respect, meaningful days, staff training, and many more social determinants have an impact on hospitalizations, injuries, medication errors, and behavioral issues. The aim of this symposium was also to help determine what quality services and supports for people with IDD involves. Findings from focus groups with workgroup members indicated that although health and safety are foundational building blocks, they are not enough. It is important for people with IDD to have meaningful lives. Informed choice, person-centered practices, goals, community living, meaningful days, relationships, dignity and respect, continuity and security, and access to technology were all described as key components of quality. This symposium was designed to begin developing a common understanding of value-based quality measures for people with IDD as the industry moves to managed care. We need to ensure definitions of quality are meaningful for people with IDD. This video was made by the IDD LTSS workgroup. To see our full report, which is called Building the Framework for IDD Quality Measures, or to find out more information, visit our website at c-q-l.org/mltss.